Hi everyone. In today's clip, I will talk a little bit about rosacea. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So rosacea is like a temperamental orchestra under the skin. Vessels flare, immune signals misfire, microbes whisper, and the face becomes the stage where redness, heat, and bumps perform in cycles. So, across all methods, rosacea is consistently described as a chronic inflammatory skin condition, primarily affecting the central face, marked by persistent redness, flushing episodes, visible blood vessels, papules or pustules, acne-like lesions, and sometimes sort of tissue thickening, especially on the nose area. Modern medicine adds that it also involves vascular instability, immune dysregulation, neurogenic inflammation, and barrier dysfunction. But there is no single cause for rosacea, and rather a cluster of interacting sort of mechanisms. So the core mechanisms are overactive immune response, abnormal blood vessel dilation, skin barrier weakness, and neurovascular hypersensitivity. And the contributing factors can be Demodex mites plus bacteria. A little explanation about Demodex. Demodex mites are microscopic, elongated little creatures that live quietly in the landscape of human skin. They're not invaders, but they are natural residents, and the mass population is in the hair follicles actually, oil glands, and all areas of the face, including eyelashes and eyebrows, and they feed on dead skin and sebum. They come out mostly at night to move and mate, and they help with skin turnover and cleanup. They are a part of sort of skin microbiome ecosystem, but the issue starts when their population sort of expands beyond balance. So to continue with contributing factors, also gut microbiome imbalance, oxidative stress, and Helicobacter pylori can be the cause. So triggers are usually considered to be heat, cold, sunlight, alcohol, spicy food, emotional stress, heavy exercises, and hot drinks. So modern medical treatments include topical agents like azelaic acid, metronidazole, ivermectin, retinoids carefully used, and vasoconstrictors. So oral medications include things like doxycycline, which is an anti-inflammatory dose, and isotretinoin, isotretinoin, if I can say it, isotretinoin in severe cases. So procedurally, the doctors can do IPL, which is intense pulsed light, vascular laser therapy, and surgical reshaping if there is advanced thickening. On the orthomolecular side of things, orthomolecular medicine side of views, we zoom out and ask what systemic imbalance is expressing through the skin. The answer usually is chronic low-grade inflammation, gut and skin axis disturbance, nutrient insufficiency, immune dysregulation, detoxification overload, dysbiosis, blood sugar instability, food sensitivity, essential fatty acid deficiency, and oxidative stress. So as you see, there needs to be some sort of evaluation done on what is causing the issue to start with because of the broad spectrum of the causes. Now, commonly suggested nutrients in high doses usually are zinc, vitamin C plus bioflavonoids like rutin, selenium, omega-3 fatty acids, gamma-linolenic acid or GLA, and niacinamide, either topical or oral. Looking at traditional and old medicine that our ancestors followed, this is interpreted through humoral imbalance. As I've mentioned in my previous clips, we have 4 humors in the body. We have blood, which is warm and moist. We have yellow bile, which is warm and dry. We have black bile, which is cold and dry. And we have phlegm, which is cold and moist. These are also called temperaments. So the likely classification for rosacea falls within dominance of hot and moist, as well as hot and dry states. So basically, there is excess heat in blood, and the vapors are rising to the face, and the weakness of the vessels lead to dilation and accumulation of impure humors. Contributing factors are considered to be hot temperament diet, like spicy fried foods and alcohol, emotional heat like anger, agitation, and frustration, liver overload, and poor digestion. So the face is the mirror of internal heat and sort of blood quality. In a case like this, we need to attend to cooling the fire and purifying the blood and calming the vessels. It all, of course, starts with diet, and the focus is cooling plus moistening foods. I'm a fan of first cleanse and then add other things. So I would definitely recommend to cleanse, a cleanse basically to take the load off the liver and improve gut microbiome. One simple sort of 10+ day diet recommended includes barley water, cucumbers, lettuce, pomegranate, if it's mildly sour, and stewed fruits, light vegetable broths, while avoiding spicy, fried, and salty foods, alcohol, processed foods, and meat. So, and of course, dairy. To help topically address the issue, wash the face twice a day with natural soaps like goat milk soap or oatmeal glycerin or chamomile or calendula soaps. If you make your own soaps, that would be even better. Use a bit of olive oil or sweet almond oil as the moisturizer, massaging a thin layer to soothe the heat and dryness, and at the end, spray a bit of rose water on the face. Also, gentle cooling compress with rose water and sandalwood are quite effective. For this, take 2 to 3 tablespoons of pure rose water and add 1 teaspoon of finely powdered sandalwood powder, and half a teaspoon of aloe vera gel, and mix the ingredients into a paste. Take a clean cotton cloth, and soak it in lukewarm water. Now wring out the excess water. You want it damp, you don't want it dripping. Then you can apply a thin layer of this paste on the cloth or directly on the face, and put the cloth on basically on the clean face and leave it for about 10 to 15 minutes. Then remove it, rinse it with lukewarm water, and pat dry it. Then you can use olive or almond oil to moisturize. For best results, as a part of at the start of this thing, when you're starting to do this, and during flare-ups, this would need to be done once or twice a day, and mix the batch fresh every time you want to use it. And always remember to patch test anything to ensure that there's not anything that's allergic to any of the, you're not allergic to any of the ingredients. And makeup, of course, is best avoided. When it comes to herbs, things like rose, chicory, which is liver cooling, fumaria, which is blood purifier, and coriander seeds are suggested. Remember that the liver is the central regulator of blood quality, and also improper digestion leads to toxicity, and of course heart, which governs heat and circulation. These are 3 things that you're working with. On the emotional and metaphysical side of this issue, rosacea often correlates with suppressed anger or internal heat, social anxiety, like self-consciousness, and emotional reactivity, like blushing tendency. Hope this has been helpful. My clips are also available on Rumble, TikTok, and YouTube. Like, share, and follow for more. Be the light.